Asthma is the most common chronic respiratory lung disease. In Kenya, we estimate that it affects between 2 to 3 million people. This disease causes a lot of suffering, primarily because it's underdiagnosed and it's undertreated.
Kati yao watoto wangu watano, kuna watatu wa kwanza ni vijana na wote wamerithi ugonjwa wa asthma kutoka kwangu, sababu mimi mwenyewe niko na ugonjwa wa asthma. Nilipolazwa Coast General Hospital ndio nikapelekwa x-ray, nikafanyiwa utafiti, nikapatikana niko na ugonjwa ya pumu. Ile shida kubwa sana inatufinya sasa upande ya matibabu. Juu saa zingine mtoto anagojeka na saa hiyo hauna hata pesa na lazima apelekwe hospitali.
The Kenya Association for Prevention of TB and Lung Disease has had a program to try and improve the care of asthma patients in this country by one, training people who are responsible for managing asthma, two, providing essential medicine for patients with asthma, and three, monitoring the entire process to be able to know what the burden of asthma is, the trends of that burden, and the outcomes of the treatment that we are providing.
Around the slum, they are very squeezed, and the way they are squeezed, they use, you can imagine, because of the poverty level, the kind of fuel they use. So it will be very easy for them to understand that when I'm cooking with charcoal, I need to maybe to open my door, because in most of the houses they don't have windows, or they use the corridors, and also involving the partners who are staying with them. If it's the children, we involve the parents. If it's the adults, we involve maybe the relatives whom they are staying with and all that. If somebody, maybe one partner, which is a husband and a wife, maybe wife is the one who has it. The husband smokes, we encourage him not to be smoking in the house.
We're able, as partners, to develop the asthma monitoring tools, that the registers, the management can, and the appointment cans, whereby it was key at least to be able to have something in terms of patient follow-up. Currently in Nairobi, we have gone to Mathare, Kibera. We are doing around 24 clinics, asthma model clinics. We have also gone to 5 regions, that's in Mombasa, Nyanza, Western, Central, and currently Nairobi. So we have different clinics, of which we have been able to accumulate quite a number of data for the same from these clinics.
To confront asthma in this country, the Kenya Association for Prevention of TB and Lung Disease has come up with a program that we are calling the Breathe Easy Initiative. The Breathe Easy Initiative will focus on managing asthma or improving management of asthma in slum areas, because that's where we believe the biggest consequences are.
The cost of managing this program on us is quite huge, because one thing is that we want to reduce the cost of this medicine to families as much as possible. You can imagine how many children will not get involved in all these activities that are supposed to be done by children just because of a disease that can be easily managed and controlled. So for that reason, we are calling on all our friends, including the corporate sector, to help us, to help our Kenyan population, to make them more productive and to make our children more productive in their childhood days, and even improve their performance in school and in their extracurricular activities, so that we can have more runners in the future, more swimmers in the future. We call on everybody. One can actually sponsor the program in terms of providing subsidy for the medicines. You can say that I will pay for half of the canister of medicine for maybe, let's say, 1 million children in Kenya. The cost of training healthcare workers is quite huge. We need to train lots of healthcare workers. We have a huge workforce. We need to train doctors and nurses. We need to train clinical officers, pharmacists, and public health campaigns. They are quite expensive. We need lots of money to produce materials that we can give to families, to children, to their parents, to even people suffering from asthma. We need to print these materials. We need to go out to the print media, we need to go to radios, we need to go to TVs and saturate our country with this information. We need money to be able to transport this medicine to all the corners of this country. So we are calling on all our partners to contribute in whatever way they can into this program, either in kind or in cash, so that we can make the life of a Kenyan better than it has been for both our adult population and our children.
To ensure that asthma care for the lower segments of this population is better managed. By doing that, we believe very strongly that we will in fact be contributing to the socio-economic development of this country, will be contributing to Vision 2030, because we must as Kenyans make every effort to ensure that the poverty levels are reduced in this country, and by controlling asthma in the slum areas, we will be contributing to poverty alleviation.